And so the new speech therapist who you're working with today, how long have you been with that person?
How long have I been at Bethel? Dan?
You're probably right about 5 years with her.
And what is it exactly that you're working on?
Talking speech.
Uh-huh.
Because NPC affects the speech, the cerebellum, and movement.
Uh-huh.
It's childhood ALS. Usually they're dead by 13 years old.
Wow.
If I get her up at 8, I try to get up at 6, so I can have a couple hours of quiet before I get Dee up, because once she's up, all bets are off. At times, I can just make my mind go blank, not worry about anything, at least for a few minutes.
What do you think she would want people to know?
It's not fair. Pray for healing for Dee, mind, body, soul, and spirit. Hail Mary, full of grace, the Lord is with thee. Blessed art thou amongst women. It stole her life. She will not give up, and she'll take each day, each hour as it comes.
Morning breath.
Okay. Her neurologist had a note from 2005 of a complaint of slight slurring of speech and slight issue with gait. It progressed so slowly that even being seen by neurologists every 3 months, they didn't see that anything was really wrong. And it took a break of about 3 years from that neurologist in 2014 saw her and said, something is wrong. They made the diagnosis of Niemann-Pick. And that was August of 2018. So you've got this ultra-rare disease where there's reportedly about 400 people in the US with the disease, 3 people over 60, and then you've got Dee with her single gene. It would be so horribly nice to have someone to compare her to. Okay, call me when you're ready. Let me know. So now we wait and work on her meds. Okay, so we'll start with the order I'd normally assemble them. She's on a supplement called N-acetyl-L-cysteine. She's on a prophylactic dose of K-Flex. We also give her a prebiotic. I'll turn that on so I can see what I'm doing. Then she's on Protonix, Colace, Senna. The next column, methocarbamol. She's on a Hippurate. Other column, gabapentin, general nerve, oxybutynin. Miplyffa is one of the drugs she gets 3 times a day. Ecnirsa, and then she also takes Fosnac, and she drinks a lot of water. Did you get lost in there? This coming March, I will be celebrating 15 years of wedded bliss. Dee says she'll be celebrating 5. It'll be our 45th anniversary. We were at a friend's wedding. I was a friend of the groom. She was a friend of the bride, and she picked me up. So obviously she's got faulty decision-making skills. Do you know what you want for breakfast? Pancake or scrambled eggs or anything like that?
Eat pancake.
When she was diagnosed, we had a fatal disease, no cure, no treatment, no support, just the knowledge that she had this disease. We didn't know anyone else with the disease. There really was no support structure. We went from nothing, and then we met people, the community. We'd gone to the annual National Niemann-Pick Disease Foundation Family Support and Medical Conference. And I was bemoaning, there were no trials being recruited. And someone said, Dr. Hastings is recruiting. And, well, who's Dr. Hastings?
Dee has been a patient of mine now for the last 6 to 7 years. I first met them at one of the National Niemann-Pick Disease Foundation meetings. I was leading a new clinical trial, and it was a phase 1 study, and I was actually recruiting adults, and I thought this was going to be probably an impossible task because up to then, all my patients had been children, and I met them. And, I laid it out and I said, there are going to be so many blood draws and pokes and all of this and travel. Are you sure this is what you want to do? I mean, they didn't flinch.
Hi, Dr. Hastings. How are you?
I'm good. How are you? So nice to see you.
It's great to be seen.
Well, I feel like you look pretty good.
She does.
Yeah. Yeah. Has your weight been good?
I can't fatten her up. Because it's affecting her coordination, she fell and broke her sacrum. The sacrum houses those nerves that allow the things in your pelvic region to function. So she has what's called saddle anesthesia in addition to her neurogenic bladder and neurogenic bowel. So she can't feel when she has to go. Are you going to take a nap? In about 20 minutes, I want you to get up and try to go to the bathroom. And then I'll go up and shower. It is exhausting, just mentally exhausting, trying to get her upstairs to the shower, getting her cleaned, getting her safely dressed again. It's as if it's a 30-minute workout every time. We try to arrange physical therapy and pelvic floor therapy for early afternoon. Step again, reach. Turn, step down, so that if there's late morning events, we're taking care of those at home rather than at those places. We've gotten to the point now that we can, if we have two appointments at the same location about the same time, we're able to have them back to back so that it's just one trip.
Dee, how do you feel? Do you feel like things are the same for you, or do you feel any?
It feels the same.
Yeah. I know what's been difficult is that you've had these falls and injuries, and which then end up being setbacks overall. And sometimes it's hard to tell what's the disease and what's a result.
How are you today?
Okay.
Anything new?
No.
Are you sure? Been any falls?
So she hasn't fallen over like 2 or 3 days.
Yay.
Yeah.
Good. Remember, we got a goal: no more than one a week.
So, and we
Right?
have
We're gonna keep that. Get those feet out a little bit more in front of you. They're too far behind. Well, not that much. You're not the green giant.
She only knows extremes. The fact that she is here and still kicking, occasionally too hard, I attribute to 2 things: her stubbornness and my stubbornness. I would not let her stop.
I know that you do a lot to take care of yourself. Is there anything that you feel that Dan needs to do more of?
No.
Pick up your feet. Don't pivot.
Thank you. I think one thing she would like less of is positive verbal suggestions.
Nagging.
Be nagging.
Yes, exactly.
You are doing,
That's what she loves doing, and that's how she falls.
and that's how you fall. Okay. We're going to practice again. Are you ready?
Nag.
Yes, dear, whatever you say.
7 miles away.
Okay, so about 15, 20 minutes.
Yes.
Hey, Tony, come on in.
Hey, traffic.
Do you need help?
I'm okay. I think I'm okay. Traffic was brutal.
Let me take your backpack and stuff.
Oh, I was gonna stick it over there.
I'll do that.
All right. Hey, Dee. Did you cause trouble?
Does she
Any falls?
Of course.
Dee, you're rolling your eyes. Is it almost time to throw something at Dan?
Yeah.
Okay, just checking. Then I know it's a good day. What caused the fall this time, Dee?
Stand up and pirouette.
She's a ballerina. The new
Yeah,
wheelchair.
we got the new wheelchair, yes, and now she's trying to break it again.
Dee,
What?
are you independently wealthy?
No.
Are you sure?
Yeah.
Then stop breaking your wheelchair.
Okay.
All right, Dee, let's get down to business.
So she gets an infusion of what is currently an experimental medication called trapsol-cyclo. The full name of it is 2-hydroxypropyl-beta-cyclodextrin, which is always fun to say. We know that it's a phase 1 trial, and so it's not intended to treat, but there's hope that it will.
All right, you're free.
Okay.
Going to the wine restaurant tonight as usual?
Yes.
Yes. What should we wear tonight?
That one.
This one? Okay. NPC patients tend to become socially isolated. So we've applied that to say that, okay, we go to wine tasting every Friday. Social event, it's all part of her treatment. There's therapy. So we do what we can. You're locked?
Dan and Dee are eternal optimists.
Not bad.
It has been very rare that I have seen them, when they aren't smiling, start with a story, what's happening with their son and a grandchild.
Oh, by the way, congratulations on your black belt.
Thanks.
That is pretty amazing.
They really, truly have accepted that this is where they're at in their lives. They're not bemoaning it. They're just moving forward. It's hard for a lot of people to understand how you can be optimistic. I mean, their optimistic is actually realism in some ways. They admit they don't know what's going to happen. They're not necessarily optimistic that things will get better, but they're hopeful that Dee will stay as she is because they are finding ways to enjoy life now.
Love you.
Love you.
Yeah, at times it can be very tiring, but I believe at some point there was a phrase about in sickness and in health, and we're living it. Honey, you need to start getting ready for bed.
Okay.
I'll put your pajamas in the bathroom. We just have each other, or I have her. If that becomes my focus in life, then other things can just fall off. Yes, dear, coming. As long as you take care of the things you have to do.
Dan.
I have to have faith and hope because the alternative isn't good. There's hope for a cure. Answer to our prayers, we've got 2 approved drugs. So there's hope that we can stop the disease. There's hope that they can come up with a cure. And there's hope that technology will allow us to correct the damage that's been done. And they're all on the horizon.
Hey, Brad.
You gotta believe it.